I'm Dr. Ian James Brown, and like many people that are in a wheelchair, we all had a tragic story. Mine started in service to the United States Air Force. I went to the United States Air Force Academy, went off to flight school. After 9/11, I switched over and started doing some combat rescue ops. And after that, I was getting ready to deploy and had a flight line accident. So I was injured in the line of duty, paralyzed at the T56 level, neuro incomplete initially, and then I've oscillated between complete and incomplete from there on forward. One of the first times that I came across the RT300 was at the Bronx VA Medical Center. And in the Veterans Affairs Medical Center up there, we have several of these RT300 devices. And I've seen my fellow compatriots using the device for the arm activation and for the leg activation. Sometimes in sequence of the two, they would cycle between arm and leg. And what this did was it got the patients out of their room, got them into the training gym, and made them feel that they're taking an active part in their own recovery. So I think that having a device like this is going to push the science forward. It's going to have better patient outcomes, and you're going to have better patient and clinician interaction because they know that they have better tools available than just a few stretching bands and a few dumbbells that are laying around. You have medical professionals that are trained in all kinds of different modalities, but if you don't give them the right tools to treat their patients, the caregiver is not able to put out their best, and the patient is not getting their best experience from this. If you give them a device like the RT300, where you can keep them on the bleeding edge of technology that has science and data behind it, give the patient the autonomy to progress at home or in therapy at their own maximum limit, you're, as a clinician, using the best tool to give the patient the best outcome. Sometimes as military members, we get taken out of the fight temporarily and we're all itching to get back into the fight. And sometimes you need something like a device like this to get them out of the bed and back into the gym to get working again.